We know that CBD is gaining in usage in society as a whole for medical and recreational uses. People are aware of it, and so our clients are coming to us with questions about their ability to use it with their pets. But this is a really dynamic landscape. So what we know about using CBD from a scientific standpoint is changing and evolving quite quickly. And the regulatory landscape is a whole other piece. And so really you've got these factors of rapid change, lots of interest, and veterinarians trying to juggle something that we want to be able to offer to our pets if it's the safe and efficacious thing to do, but also it's hard to stay abreast of it all. So it's, there's a challenge there that really comes from wanting to care for pets and doing it safely. We have to accept that we don't know everything, but we can engage with our clients and we can have an honest and partnered conversation with them so that they know that we have their pet's best interest at heart. And I think that's really crucial because it's far better for our clients to know that they can come to us and ask questions versus feeling that they have to go to a friend or they have to go to the internet or some other less reputable source where they may or may not get the most accurate information. So let's say, I'm walking into the exam room and Mrs. Smith is there with her dog Fluffy, who's old and having some chronic pain issues. And she says to me, Dr. McAllister, my neighbor next door said that, she's been using CBD oil for her arthritic joints and she thinks it's making a difference for her. And so she offered to give me some for Fluffy. What do you think? My response to that is, well, let's talk about what's going on with Fluffy. What do we know about Fluffy's medical condition today? And we have that discussion about what are the individual needs of that pet. And then I think there is an important piece to convey to Mrs. Smith that today I don't have the ability to make a safe and effective recommendation for how you would use that. And in fact, we need to be cautious because that oil could be quite toxic to Fluffy. And so we need to be very careful, and I can't make that recommendation to you today. However, I do know, staying abreast of the literature and using the resources that are available to me, I know that we are learning more and more every day. And I would love to continue talking to you about this at your next visit when we have you come back in 3 months or 6 months to see how Fluffy's doing with what we're doing for her today. Let's revisit this conversation and see if we know more, see if the landscape has changed, and if this is something we feel could genuinely help Fluffy as we maintain her quality of life for as long as possible. Talking about tricky subjects like CBD, really I think the first important piece is to acknowledge where they're coming from, acknowledge that the situation is emotional and difficult for them. And with every person that looks a little bit different, so there is a piece of reading the person, but recognizing that they're there because they love their pet. They wouldn't be feeling that emotion if they didn't care deeply about their pet. Our job as a veterinarian, and I believe more and more it's the evolution of our role, our job is to partner with them for the best care that we can deliver for their pet, and they have a role in defining what best care is. And so in a situation like CBD, what is tricky is that under my license, I don't have the ability to make a recommendation. I'm not choosing to not make that recommendation to that client. But I think what is valid is to say, gosh, Mrs. Smith, I really can understand this is frustrating. You're seeing Fluffy have a lot of problems in her day-to-day life, and I know that you want the very best for her. And I acknowledge that that could make you angry that you don't have a solution. That could be frustrating, depending on her feeling, that could be frustrating that you're coming to me and I don't have a different answer for you. That you're incredibly sad because you don't have a solution for Fluffy. I want to work with you with what I have available to me, what I'm able to do from a safe and effective standpoint so that we can take care of Fluffy together in the best way possible. And I think what's important to realize in those conversations is that you're not necessarily going to immediately flip the switch. Emotion is real. When people care about their pets like family, it's normal to have emotion around that. And so we have to recognize that we can't necessarily solve the problem, but what we can convey is that we're open to communicating and we're open to partnering, and that we're willing to work with the client to prioritize what's important to them, not that we have our own agenda for how we're going to treat their pet.